So we understand that in 2016, Bergen County became the first county in the United States of America to literally reach functional zero for both chronic and eventually veteran homelessness.
Correct.
Let's just kick the conversation off with
right there.
how in the heck did you how'd
I
you
have
do
to
that?
tell you, even when you say it, I still get goosebumps. Like it never is lost on me, that accomplishment. So it's so nice to hear you say it. And when you say it like that, it just makes me feel like really wonderful. So pretty much Bergen County was very much like most places, which is we had 4 temporary shelters, and our faith-based organizations and government institutions were doing their best that they could to address homelessness. But homelessness was going up, and chronic homelessness specifically was going up. So HUD happened to require any of the communities, the COCs that were getting money, to do a 10-year plan to end homelessness. So the County of Bergen used this time to actually do a stakeholder inquiry. They hired a consultant. The consultant came in and interviewed 200 stakeholders and said, if we were going to change our homeless system, if we were going to redo things, what do you think we should do? And documented all of that input into a document. And at the same time, was also looking at best practices around the country that were working to end homelessness. The number one being this model of housing first. So the county now has this document that says, these are some of the things that our folks in our community were talking about. We need one shelter. We don't want multiple places to bring people. We want one place to bring people. We want something to be open 24 hours a day. We want to have one place that you can get food and get services. We want all those things kind of co-located because we're in the suburbs. Not everybody has cars. Our transportation is not like it is in a city, in a large city. And they also wanted to make sure that people could get access to housing, that it wasn't just enough to shelter people, but also get access to housing. So using this model, and then also looking at housing first, what the county decided to do was in their 10-year plan was to have one big facility, one brand new facility, and that this facility was going to now become the one stop for homelessness. And they built a 27,000 square foot building, which is the shelter. It also has a feeding program. It has multiple flex office spaces located in this building. And the design was really that everything addressing homelessness was going to happen in this one place. So they did build this facility. We opened it October 1st, 2009. I was hired as the director. And what we did was we closed down those other 4 shelters. So those other 4 shelters were no longer in existence. But what the county did was they did RFPs. They did a shared service agreement, which I'll talk about in a second, which is with my agency. But they did 2 RFPs. And the RFP for the shelter operations and the drop-in center was awarded to the church that was the shelter. So even though the church now no longer has it at the church, but they're now managing this work with us in the building. So the other RFP went to a mental health organization, which does case management. The key partner agency that a shared services was done with the County of Bergen was the Housing Authority of Bergen County, which is really a brilliant stroke of genius to have the Housing Authority at the helm of this work. Because think about it, the Housing Authority has housing, right? So the Housing Authority hires me. I have a background in supportive housing for 20 years in New York City. So the Housing Authority now is at the helm in terms of the management of this facility. You have Christchurch Community Development Corporation, they're managing the shelter operations, and you have Care Plus New Jersey who are doing the case management. So basically what the county does is they build the facility, but they don't have any of their folks working in the facility. They put the experts in the facility who actually know how to do this work, but they do it as a collaborative. So we're all working together, but we all work for different organizations. So my job is to keep everybody having fidelity to their contracts and fidelity to a housing first model, but also working well together. And then what we do is in the facility, we have offices that are flex office spaces where the other partner agencies can come in and do what they do. So for example, the Board of Social Services that does our welfare, our food stamps, all of that, they have an office 3 days a week in the facility. So our folks don't have to go up to their office, which is chaotic in any place. I don't care where you are. It's chaotic. It's difficult to maneuver. And now their folks are with us. So right in the shelter, in the center, they can take a application for food stamps. They can take an application for general assistance. And we can have the documents that people need right on site. It's really fabulous. We also have people who do our outreach to the homeless. They have office space when they need it. We have our HIV program was located on the property. So the idea is that when you open up a facility like this, the first thing that happens is everyone gets very nervous because they think you're going to put them out of business. So it's very important that if you do this kind of model, people understand that the county's not going to do what you're doing. The county just wants you to do what you're doing here. And they're going to give you free office space to do it, and copiers and printers and whatever else you need, and a phone. But we're just going to ask that you do it here. Because the idea that homeless people are going to leave the center and go transversing through the city of Hackensack is the reason people don't like homeless people. They don't want them transversing through the community. They don't want to see the shopping carts and the dirty clothes and them talking to themselves. So what we've created is all the services they need are here at one place, plus food and clothing and showers and phones and medical care. And we've put it all in place in one facility. So through this facility, we also have access to housing. So the Housing Authority does do set-asides. We do have set-asides, and they do make our homeless individuals priorities for housing. We have a by name list. We have a coordinated assessment. We have a housing prioritization list. Everybody gets scores. Everybody gets numbers. So really, if you create something where you're taking people off the street as a priority, you're taking your sickest folks with mental illness, with drug abuse, with criminal histories, right? All of that. And not only are you taking them, but they're your priority. And you're a low barrier shelter, and you're taking them into your program. And then you're focused on housing them, putting them into housing, even if they're not taking medication, even if they're still drinking, even if there's still things going on, we're still housing them. So we focused on our most chronic folks through this building. And because the building was new and it was clean and it was safe, we have security there 24 hours a day. It's safe. People will come off the street and stay there because they weren't afraid, because it was clean, because their stuff wasn't stolen. We let them bring their personal belongings in. Everybody has like 2 bins to put their things in. So your first thing is, can you get people off the street? Will they stay with you in shelter? Will you prioritize them? Secondly, are you getting their documents recovered? Are you getting them IDs? Are you getting them the basic things? Are you getting them welfare and food stamps? Are you getting them those things as quickly as possible? And then getting them into housing. So basically for us, housing ready means you have an ID. That's housing ready. It doesn't mean you're not drinking. It doesn't mean your mental illness is gone. It just means that you could sign a lease today. That's what that means. So we work very hard to get people housing ready, and that's the role of Christ Church through the drop-in center. So we have a drop-in center every day, twice a day, 365 days of the year in the facility. So if you think about it, what it looks like is you get up in the morning, you have breakfast, then we have our drop-in program. We have coffee. You can go see the person from the Board of Social Services. You can meet with a PATH person. You can meet with a mental health case manager. Then you have lunch on the property, and there's no cost for any of this. Then after lunch, we have our drop-in program again. And our focus with our folks in shelter is about housing. It's all we talk about is housing, because we have a number of people that would be more than happy to live there for the rest of their lives and never leave. Because there's no cost to stay at the shelter. You don't have to pay to stay there. You don't have to have your benefits in place to stay at the shelter. You have to get them to continue to stay at the shelter. So we focus very heavily on making sure people go to housing. But I think another thing that's really important about what we do is that if I house you, you can come back for lunch or dinner every day if you wanted to. So we remain a touchstone for people. We can still provide food to people if they're living in the community. People do that. They do move and they come back and they just have meals with us. But what's great about that is we can kind of look at people and be like, I don't know, they look a little thin, or they're asking for a shower. Why are they asking for a shower? They have an apartment. What's going on in your apartment? Is your utility so we can intervene much farther, upstream before people get in real trouble and they've been evicted. So that's wonderful about it is that we have all these services on site, including prevention dollars. So we can actually have a family come in and we can provide them with rapid rehousing. We can do security deposits. We can do first 3 months rent to get people back on their feet without even being in shelter. So we can do diversion. We can do rapid rehousing. This works. What we're doing here is how you end homelessness, because what we were doing was we were not managing homelessness anymore. We were ending it. And that's a very, very big shift. There is a traditional way that people want to help the homeless, and that way doesn't work. It's getting people to think very, very differently about how we interact with the homeless. Also working with the police. When we first started working with the police would just kick people out of their car at the front of the center and have them walk up. And I started calling the police precincts like, what is that? What is that? Like, no. You have to come in the building. You have to tell us where you found the person. You have to tell us what happened. We have to determine whether or not they have to go to the hospital. Like, this old way of interfacing with the homeless had to stop. So I created a whole thing called the Hackensack Collaborative Outreach. It's a meeting that I do every 3 months. For 11 years, I've done this meeting every 3 months with law enforcement, local leaders, city council members, the mayor's office, also advocates, the business district, the library, and we get together every 3 months to talk about, what are you seeing locally? Are you seeing an uptick in the squeegee? We haven't had a squeegee guy in 8 years. I got rid of the squeegee guys. I mean, that was no small feat, but basically, we stopped enabling that kind of behavior by basically saying, hey, listen, if you need something, you come down by us. You need a meal? Stop going and begging at the restaurants. We're going to give you a free meal. So I worked with the restaurant owners to get people to come down by us. So this took years of changing this culture of the way that people were interfacing with the homeless. So now they're part of everything we do. And so I started to develop these relationships with people in the community about, stop doing this old way, do it this way, but you get to be part of it with us, that we together as a community can end homelessness together. And when we did get to functional zero, which is a surreal, unreal experience, all those people were at our press conferences and continue to be our partners in this work. So I always say to people, when you come up to look at Bergen, you're looking at 3 things. So think about our facility as a car, as a race car, like this beautiful, shiny, really fast race car, right? Race car can't win a race by itself. It needs a really good driver. So I'm the driver. I'm the driver of this process. Now, in a car race, right? You have a good driver, you have a great car, you still need one more thing. You need a really good pit crew, right? So who's your pit crew? Your pit crew are all the organizations that provide the vital services. If you don't have one of those things, you're not going to win the race. And ending homelessness is the race. The government will tell you that the most important ingredient is political will. And they're absolutely right. Political will is huge. Because this facility and this process was the government. So when I do presentations, people are like, how'd you convince the government? I'm like, oh, no, this is the government, and they hired me. And I'm able to do fabulous stuff because they support my fabulous stuff. I'm carrying out their vision. I'm not so sure they believed that their vision was going to happen. I think I surprised them because they didn't hire me and say, you need to go end homelessness. They were like, you need to go run this facility. I'm the one who said, we can end homelessness. Like, we're like right there. Like, let's do that. So that's what most people in our government would say is it's political will. And a lot of people would say, yeah, that's the number one thing. My housing authority that I work for would tell you it's housing. That if you don't have housing, you're not going to end homelessness. That's true, but housing isn't enough because you can give somebody a voucher. It doesn't mean they're going to lease up. It doesn't mean they're going to find something. You got to have that good case management. So I think from all these years of talking about what we do, I think ultimately it's leadership. Because leadership will find a way. We're a community of 1 million people, 1 million. And on our last point in time, we had 4 unsheltered homelessness. And I'm just like, why is no one doing a ticker tape parade for us? We had 4 unsheltered homelessness. And people like, and I'm just like, no, nothing, no applause, no, like, that's unheard of in a community of 1 million people. Because we got in front of it and you stay in front of it. So you all know, all of you on this call, you know what you need to do. It's just getting everybody else to understand what you understand. It's about inspiring people. It's about, if you look behind me on my back wall, the 2 letters on either side, well, the letter in the middle is Cory Booker. It's a big deal for me, I'm just saying. But on either side of that, one is for ending veteran homelessness and one is for ending chronic. When you get to go to the White House and be thanked by your country for the work that you've done, there's nothing like that. Like that feeling is just, you want people to understand that this is the right thing to do. It's the cost-effective thing to do. It's the thing that makes, I don't want to live in a community where I see people sleeping outside. I'm not okay with that. In fact, if I see a person outside, I literally pull over my car. I pull over my car with my friends, family, I don't care, in the car, get out of my car with my phone. Who are you? What do you need? Let me get you, because you can't sleep on the street. I'm like a police officer for 1 million people. Who is speaking for you? So the thing I would say to you is that if you would like me to, at another juncture, to have a conversation to speak to the powers that be, I'm happy to do that. I just did that for Tucson. I spoke to their mayor's office and they had a big event. And because I can be like, listen, I'm Jersey, but this resonates. The stories that I can tell and the struggles that we have are the same. Our people are the same. The reason they're homeless are the same. The reason they don't want to be housed are the same. But we need to inspire people to take up the gauntlet, to say, no more. If you're 120,000 people in your county, you don't have to take it to scale. You're not Los Angeles. That's a real problem. Like, that's like, I was out there last year in California. I cried what I saw. I cried how bad it was. Your problem is solvable. You can actually meet this need. We need to make sure that if you're not there, that this work's going to continue. And you know what? I know that it will, because we've put in place the rule book to make sure. But I remember writing that out and thinking to myself, I want to be first, because I want to be able to inspire other communities that you can do this. We can end homelessness. It's not like a made up thing. It's actually a real thing. You can actually bring your numbers down and you can sustain it. And you can have an effective crisis solution for people that fall into, because it could happen to anyone, especially during the pandemic. Haven't we learned that? It can happen to anyone. So again, I extend that invitation to you. I'm always happy. If you can tolerate listening to me this long, I'm certainly happy to talk to other people about it.
Well,